Imagine music being medicine. You're healed and healing from a frequency of your choice. Imagine that. Now imagine you're stress free, reduced of pain, and your symptoms of depression are starting not to exist. Don't like taking big pills? Are they hard and complicated to swallow? We have known medication to be something you take and sometimes has side effects. Well, you don't have to worry about the side effects when it comes to music. Now, what brings me to the topic of my speech is music therapy. Music therapy is a cognitive behavior therapy with many individualized people who can benefit in the changing of their behavior. In 2002, music therapy was found to ease and lessen the pain for people with cancer, just like in The Journey of Pain and Symptom Management by Alexandria Lynch. Further in the research of a 2022 meta-analysis of 15 randomized controlled trials involving more than 1,000 older adults with depression, there was a significant effect in the reduction of symptoms in study subjects and lower side effects compared with prescription medication. The purpose of this speech is to give you the facts in how music therapy works. To do so, we will view the changes and benefits of music therapy. We will be learning how music therapy heals individuals, and we will be learning the history roots of how music therapy became. Now, let's start with the history of music therapy. The roots started with medical studies, started in the early 1800s, and it suggested as a therapeutic intervention forming an empirical basis. Music therapy began in ancient culture beliefs. It was believed to have a healing effect on the mind and the body. During the late 19th and early 20th centuries was the foundation of medicine, music therapy. The doctors began establishing progress from no science to soft science and then to brain science. There was evidence of the start of music therapy found in historical civilization like Mesopotamia, Egypt, Israel, Greek, Middle Ages, and Renaissance era. More medical studies in 1914 were noted by physicians that were exposed to music in surgery patients that helped reduce levels before operations took place. This power of therapeutic music has a capacity of invoking emotions, memories, and to heal. Not only does music heal, it is a language that extends across culture and linguistic barriers that unite people together. The multidimensional bringing for medical care gave music therapy to continue evolving with research advancements while it continued to grow. In music therapy today, it is much more common in hospitals, correctional facilities, mental centers, and centers serving children with development and learning disabilities. It now continues to be more progressive methods that are included in today's world, like listening, improvising, recreating, and composing. Even improvisational methods are used to help encourage babies to latch more with breastfeeding and humming to soothe a child with autism. Many who benefited people were sometimes the one who could not speak and had trouble talking, through their thoughts and feelings. It has also helped individuals with traumatic brain injuries, substance use, behaviors, dementia, and chronic pain. Some examples of how it heals is through relieving through stress, physiological, and claiming positivity behaviors. This can treat symptoms of depression. Music therapy helps the movement disorders of stroke, epilepsy, MS, and Parkinson's. The research of Italy reviewed 25 studies and wrote in the World Journey of Psychiatry in 2015 that the mood changed and increased their quality of life with the disorders. Let's now get into the understanding of history of music therapy and how it benefited others. Since early days of life, music and its power has been very clear to us. Gillian Levy, in 2017, gives us the 6 major health benefits to music therapy to view. Music reduces anxiety, and physical effects of stress. It improves healing, managing communication, self-expression, and reduces the psychological disorder of schizophrenia. A many common goal of music therapy is to improve motor function, social skills, emotions, coordination, and personal growth. How we improve these are by using vocal gestures, making eye contact, initiating interactions, sensory skills like touching, listening, physical skills like movement, brain skills, attention, imitation, and last, the emotional skills, which in expressing feelings that are nonverbal. Music has many various effects on brain activity and has shown core structures of how emotions can be processed. Music can also change to mimic the heartbeat. Isn't that interesting? Believe it or not, music will forever be around, healing and bringing joy to us all. In the last of my speech, I address the history and creation of musical therapy and how it is used in society today, as well as the benefits to certain individuals and their effects. The purpose of the speech is to make sure you understood the facts and benefits of music therapy, and I feel like I've done that. We know now that no matter what kind of music you choose, music will always be therapeutic and a universal language to bring all healing and unity.